Hi, I'm Christopher Villafort, and I will be doing Part A of Condition Presentation, Attention Deficit Hyperactive Disorder, better known as ADHD. ADHD is considered a neurodevelopment disorder. To get a better understanding of neurodevelopment disorder, it's basically a disorder that manifests during the developmental stages of a person, and also is evident by significant impairment of personal, social, or academic and or occupational functioning. For ADHD specifically, this disorder has impairment levels of inattention, disorganization, and or hyperactivity and impulsivity. For the diagnostic criteria, there are two symptoms that are usually present within ADHD. So criteria A1, which is inattention, and also criteria A2, which is hyperactivity impulsivity. Usually, an individual will either be diagnosed with both symptoms or at least one. For inattention, the individual will have to meet the criteria of 6 or more of the following symptoms that are prevalent within the last 6 months. I'm not going to actually go over all 9 of the options for inattention. However, I will briefly discuss some. And so one of the symptoms that could be present is the individual fails to give close attention to details. They make careless mistakes within schoolwork or with their work assignment, things like that. Another symptom is that the individual doesn't seem to be listening when they're being spoken to directly. So an individual, while speaking to them, may seem like they're absent-minded or they're preoccupied in thought. Also, another symptom, or another symptom would be that the individual avoids, dislikes, or is reluctant to engage in an activity or an assignment or task that requires mental effort. So, completing homework, reviewing lengthy papers, reading assignments, paying bills, things like that. Another symptom would also be, especially because I said paying bills, would be that the individual often forgets the daily activities. So again, not paying the bills, not returning phone calls, not doing chores, things like that. And one other symptom would be that the individual loses the necessary items that they need to complete a task. So they lose their cell phone, they lose their eyeglasses, or school materials and things like that. So this is just some of the symptoms that an individual would have if they were meet the criteria for inattention. And just to be mindful, again, that the individual will have to have at least 6 of these symptoms, and that's for an individual that is 16 and younger. Now, if the person is 17 and older, the criteria is reduced to 5 symptoms in order for them to actually meet the criteria A1. Now, that stipulation is the same for criteria A2 for hyperactivity. So again, if the individual is 16 and younger, then they have to have 6 or more. If the individual is 17 and over, then it would have to be 5 or more. And for hyperactive impulsivity, the symptoms would include The person's fidgety, tapping their fingers, unable to sit in their seat, or if they're sitting in their seat, they're squirming. Um, they're feeling like they're on the go, can't seem to stop, or, they may end up bumping into someone because they're just going. The individual may talk excessively. They may blurt into a conversation because their inability to wait for the other person to continue their statement, or they're touching things or taking other people's items without permission. One symptom that I definitely do want to point out that would be very important is that for the symptom C under hyperactive and impulsivity, is that for a child, it would be that they're running or they're climbing in situations that are considered inappropriate. However, when it comes to an adult or a child that's in their adolescent stages, this symptom is actually more internal versus external. So again, for a child, you might see them running around or climbing when they're not supposed to, but it may actually shift and where it's more of an internal thing where the person actually feels restless versus actually acting out their behavior. So you want to kind of take note of that when actually diagnosing that particular symptom. For criterion B, the symptoms would have to be present prior to the individual turning 12. So going back to ADHD being a neurodevelopment disorder, that particularly means that oftentimes that the mental disorder is present during the actual development of the child. So for ADHD specifically, the inattentive and hyper impulsive symptoms will have to be present before the person turns 12. So even when you're talking to an adult and you're diagnosing them with ADHD or taking into consideration to diagnose them with ADHD, you want to ensure that you ask the right questions and explore if these actual behaviors were present while during their childhood. For criteria C, the symptoms are present not just in one setting. So the behaviors are visible at home and at school and at work or within the relationships that the individual has. So you want to make sure that that it's actually present within more than one setting in order for it to meet the criterion. The next criterion is criterion D. So the symptoms interfere and reduce the quality of functioning. So the individual has the inability to produce quality work at school because of the hyperactive or impulsive behaviors that they have, or because of the inattentive behaviors. They're disorganized and are not present while they're not present while the teacher is speaking because they're distracted by something, or because of impulsivity, they're unable to sit still in their seat. And the same can be said for an adult. As far as work is concerned, they can start a task, but they're unable to finish. So you want to make sure that when diagnosing a person with ADHD, that within the criteria of D, that it is causing quality. It's affecting the ability to produce quality functioning. For criteria E, you also want to assess and ensure that the behaviors that are produced are not exclusive to another diagnosis. An example would be schizophrenia or another diagnosis such as a mood disorder or anxiety disorder, or even a substance intoxication or withdrawal. So when looking at it, you want to make sure that the behaviors are not exclusive to some other disorder. Far as specifying ADHD, there's 3 categories. The first one is specifying whether there's a combination, meaning that there's a presentation of both criteria A and criteria A1, which is inattention, and criteria A2, which is the hyperactive impulsive symptoms. And then you have the other 2, which are the predominantly inattentive presentation or the predominantly hyperactive impulsive presentation. And what that means is that one diagnosis is more prevalent, or the individual symptoms meets the criteria for one of the criterion, but not the other over a 6-month span. The next specification, I can't get the word out. The next specification would be if ADHD is in remission. So if the individual met the criteria fully previously, but doing assessment within the past 6 months, the individual no longer fully meets the criteria, but there's still symptoms that causes impairment, then it would be considered the ADHD in partial remission. The last specification is the severity. So mild, moderate, or severe. So mild would be if the symptoms causes minor functional impairment. Mild would be that there's a presence of both the mild and the severe, and severe would be that there is either an excess of symptoms that causes impairment, or that the symptoms are extremely severe on the level in which that the person is significantly impaired in their function as far as the social and occupation. Okay. Differential diagnosis. So I'm not going to go over all of them just for the sake of time. However, looking at the diagnoses that are present, there are actually 16 differential diagnoses. And so just taking consideration is that the symptoms for ADHD are very similar to other diagnoses. So you want to be mindful that when diagnosing or working towards diagnosing a person with ADHD. And I have included a video called How to Explain ADHD, which I believe is an excellent video because the host herself also has ADHD. And I think it would be a good, I think it's a great explanation of ADHD on the more layman's terms, as well as from the perspective of a person who actually has ADHD. And so this ends part A of the presentation for Attention Deficit Hyperactivity Disorder.